Did they have a facelift? If not, what did they do? There's a reason you can't quite put your finger on what celebrities and even your friends and acquaintances have done to look so darn good all of a sudden. Stick with us as we share changes to technique, why many procedures are out of mode, at least in our practices, and just what else might be going on when people look shockingly or even subtly better in today's episode of Vital Discourse.
For years, facelifts carried a very specific image. Tight skin, frozen smiles, pulled mouths, and celebrities who suddenly looked like completely different people. But in the last few years, something has changed. Suddenly, people online started saying the same thing. How does she look younger than 50 than she looked at 40? And the conversation exploded around celebrities like Lindsay Lohan, Anne Hathaway, Kris Jenner, Bradley Cooper, and even Brad Pitt. People started wondering, is this skincare? Is this weight loss? Is this lasers? Is this Ozempic face from GLP-1 related volume loss? Are we seeing a new era of facelift surgery that looks dramatically more natural than the older generations did? Today's episode is about what modern facelifts actually are, why public perception is changing, what celebrities may be showing us about current techniques, and how to think about facial aging realistically in the social media era. Today I'm here with Dr. Ben. We're talking about celebrity facelifts. And Dr. Ben, why do so many celebrities look 15 years younger overnight?
Look, everybody wants to know that. I think that there's been a dramatic shift in the techniques around facelifting, especially in the last 10 years, especially in the last 5 or 6 years, to be honest. There's a lot more understanding about what's happening with aging. There's there's also non-surgical things that are taking off. There's really effective and better understanding of how to fill volume back into the face in a much more natural way. Of course, there are also bad examples out there that you see with overdone lips and overdone cheeks and whatnot. But I think that skincare is also dramatically changing. The use of peptides in working on skin aging. GHKCU, for example. I also think that our use of lasers and light for the face has gotten better. Strangely enough, the number of facelifts has gone down in the last 2 years, but in general, I think it's because plastic surgery and plastic surgeons have gotten a lot better, to be honest with you. I mean, I think we understand it. This is an evolution. It's a constantly evolving technique and science. And what we're seeing is really good work being done, to be honest with you, on all of those fronts.
So what I see a lot, and I think a lot of people see a lot, at least from the older techniques, is you would see someone with really, really tight neckline and huge puffy cheeks, right? And so where was that going wrong?
Yeah, it's also that windswept look where, because of the vectors of pull, I think it's a couple of things there, Ali. And to get into it, we have to quickly go through the progression of facelifting from the late 1800s, early 1900s to today, so that folks can understand what I mean by vectors of pull. Because there's been an actual a progression that happens in jumps. So, way back when, it was ushered in. It was kind of a taboo thing to be doing surgery for the way you look. It was really frowned upon. So it was done in secret. No one talked about it. And it was really just sort of answering the questions that people ask and look in the mirror and they say, what if I just did this? Wouldn't that look so much better because you got loose skin hanging there? And backing up for just a second, we're all turning from grapes into raisins, right? We're all losing volume and structure. Everybody knows that now because of all the research on how we age and die as humans, right? Our cells kind of kill themselves, and a process known as apoptosis, after about 60 to 80 generations, right? So we're literally dying from the day we're born. Men have about 37 trillion cells, women have about 34. And those are slowly going down. Well, some of those have support functions. Some of those cells that are dying have support functions, volume functions, and actual functions in organs. So we all recognize aging, that process where you're getting slower and weaker and your eyesight's going and whatnot. On the face, it looks like basically emptying a bag out. And the vectors that we use to try to fix that were first just sort of skin. So, right, remember the skin-only facelift was the rule of the day in the early 1900s. And then people started to figure out, well, why does this only last 6 months or so? And that's because the problem is not really in the skin. It's the tissues below that, what we've come to know as the SMAS. And a lot of facelift junkies out there might know the term SMAS because the SMAS lift did the work here. I think it was first introduced by a gentleman named Skog in Sweden, but in general, that became the workhorse for many years. Well, if you don't address the deeper structures and you don't detach where the face is solidly attached to the bone, what we call bone cutaneous ligaments. There's 3 of them basically. Then you have this weird look where there are static places in the face, the cheek and the jaw here and back by the ear. And then there's places that you pull. So you get this really telltale swept look, and it's fairly unattractive and easy to identify when you're walking around in public.
Yeah, what most people don't realize is that literally the skin can stretch infinitely if you put enough pressure on it. Right. So in reconstructive surgery, what we can do is we can actually put a little balloon under the skin and slowly inflate that balloon over time. And what it does is it stretches and stretches and stretches the skin. And now we have all this extra skin to do a reconstruction with. Right. So literally, when you pull just the skin back, it's going to keep stretching and you're not going to get the result that you want. So Dr. Ben is kind of explaining how it's not the skin. It's what is underneath the skin that's the issue, and that's what has really changed over time.
Do you think so? So Lee, you hit on something really good there. You can stretch it almost infinitely, but the fact that you need to stretch it, I think a lot of it is volume too. We've really gone to the idea that you don't want that hollowed out look, and it comes with age, no matter what. And so not only are they repositioning these tissues back up to a younger position, but we're filling the bag back up with certain fillers. There was a huge jump that we took in the outcome of our facelifts when we realized that and started getting better and better products to put into the body. Most people use products like Restylane, Juvederm, and those are hyaluronic acid based. And what that means is that's the stuff in between cells, the ground substance in between cells. So it's fairly natural. It's reversible, but lately it's fat. Taking actual fat cells from one part of the body and placing it into another, and there's a lot of science behind that. And it's not just filling it up. You're taking stem cells and body substances that allow you to maintain youth, and you're transferring it into the area that you're trying to rejuvenate, the face. So it actually kind of makes the skin look better too. I think people have noticed that, but there's some science behind it now. They've actually done some studies on it, right?
Yeah, and I think that you're bringing up a great point because the hyaluronic acid-based fillers tend to last a lot longer than people think. I mean, there are studies that show fillers lasting 2 years, 15 years, depending on the person and how their specific body.
And that range is exactly the problem, right? 2 to 15. I mean, because you don't know. Sometimes it goes away quickly. It's how your body metabolizes it and where it's placed.
And so you get the stacking, right? I'm gonna get Juvederm every so many weeks, and then it keeps plumping and plumping and plumping, and you're waiting for it to go back down, and it's not going back down.
It doesn't go back down.
And before you know it, you've overdone it. So you've got this swept appearance with these cheeks coming out to here, and you look like a caricature.
Yeah. Well, I mean, but that's also, we're getting better at that though. You see less of the crazy look walking around with the big duck lips and the overfilled cheeks. I think because one, it's reversible. So that's the good part about it. So the hyaluronic acid ones, because you're typically being charged by the injector for the number of vials, there's a tendency in folks that are pushing to make money to overdo it. That's one. But you can reverse it. There's hyaluronidase, and that goes in and dissolves it, whether it's an accident or, there are problems with this, just like there are problems with fat. Fat's not, perfect. If you take fat from somebody's hips, especially a female's hips, it's going to behave. It still has the same receptors as it did when it was in the hips. So when she puts on weight, and she normally puts on weight in the hips, she's going to put on weight in the face. So it's not without its downsides. And to remove it, actually not all of it lives. So you might have some patchy take of the graft, because it's a graft, right? So you're sticking it under the skin, and some of it might not live. And if you overdo it, compensating for that, it might all live, and then you've overdone it. So you got to be really good at what you're doing. But I think the really natural ones that we see that last a long time are the people that have their skin, their tissues repositioned, and a little bit of volume put in from their own fat. I don't know if you agree with that, or if you think the hyaluronic acid is a little bit easier and more precise to place.
Well, it's definitely easier and more precise to place, which is the reason that so many people are doing it, and so many different specialties are doing it. It's the reason that people have parties to do this stuff, and being done by unlicensed practitioners.
Which we're not supposed to do. No one's supposed to be drinking, putting this in.
Which you're not supposed to do, and we do not recommend under any circumstances. But you don't really see back alley fat transfers, right?
Right. Yeah. No, because for obvious reasons, right?
Right. So if we're looking at what's going on with the facial structure over time, our fat pads are descending. They're also thinning out, right? We're getting atrophy of our fat pads. The bone structure changes over time. We lose skin elasticity, collagen, that type of thing. The ligaments loosen. All of our volume is shifting downwards. Gravity is taking hold. Dr. Ben, talk to us a little bit about the bone structure changes that we see over time.
Yeah. So, everything ages. I talk to people about this. We've talked about it on our snoring episodes and sleep apnea, right? That the muscles of the back of the throat are getting weaker and they're losing volume and whatnot, and they get floppy and they shake around. Same thing's happening in your skeleton. You don't think about it so much because you think of the skeleton as the one thing in your body that doesn't change. But, like my mom would tell you when she was still alive, she was starting to curve over. You can see the kyphosis in the back. That's an obvious change, but it's happening to the skeleton that represents our face. We're losing height of the mandible. Some of it has to do with teeth, and whether you're edentulous or not, meaning no teeth. But in general, your cheekbones, everything is losing volume and structure. So that can change the way you look in general. So you're redraping the skin, sure, but you're redraping it over a skeleton that's changed over time too.
Yeah. So over time, generally speaking, what you might see is the rims of your orbit here, they actually will get bigger over time, believe it or not. Now, bone is constantly turning over. Our bones are constantly breaking down and building back up. And so that's why you can see some bones might grow in size and some bones might decrease in size.
And that's made worse, right, by the descending tissues. So the flesh over it sags down, and then these are sort of building up, and so you have this more sharp delineation there that everybody recognizes. You don't have to be a doctor. Everyone recognizes as aging around the eyes.
Yeah, it makes it look like your orbits, your eyes are setting back further, which gives you a more aged appearance. Your
Skeletor look.
The angle of your mandible, this bone, which used to be so nice and beautifully sharp, why is it not sharp looking anymore? Because the bone is actually resorbing. Right, so you're actually getting a less acute angle to your mandible. The middle of your face here, the bones that basically make the opening for your nose, those bones also will decrease in size over time. And so what that does is it makes your nose look longer, right? So they were, why does my nose look longer? I don't get it. Is my nose growing?
That's the old wives' tale, right? That the nose and ears keep growing. It's not that they're growing; it's the way that they age create more length, right? Gravity is pulling this thing down and pulling these down, and so you've developed this idea that they keep growing. They really don't. It's just how ears and nose age, like the rest of us. It just looks like they're growing.
So Ben, go over with us what you would characterize as the modern facelift. What are we addressing? What's the actual technique that we're using, and what would we do differently, for example, in a female versus a male?
That's a great question, and you cannot talk about modern facelifts without talking about Andrew Giacono, and he was a classmate of mine at Einstein. He's based in New York, and he's absolutely gifted at what he does, and he's thought about it in so many different ways. And some of it comes from just having an incredible thirst for knowledge and understanding about how to make it better, and being in a tough environment in New York. They expect a very high level of facelifting for the money that they're going to be paying. He was one of the first people to usher in the $250,000 facelift, and do a lot of them. So what does that mean? Well, he really started thinking about it. I've been over there, watched him operated with him for a week or two, and I was really impressed by how he had changed as a practitioner over the 15 years or so that I had known him. But he kind of, and there's many other folks out there, Mike Nyack in the middle of the country, a lot of really good facelift surgeons, started to realize that the cutaneous ligaments, so the deep plane facelift became sort of the sine qua non of the ultimate expression of repositioning. But until he started routinely and expertly detaching the face at its sticking points in these osseocutaneous ligaments here over the cheekbone, the jaw right here, and then back towards the back of the mandible and the ear bone here, the mastoid, that it really took a giant leap forward. So they remember that we're always looking for new names to call things. One, to hide the fact that it's a facelift. You have the lifestyle lift and the short scar lift and all this stuff, or you call it a neck lift. The facelift in general is in three parts: upper, middle, and lower face. So really the facelift, however we call it, the max lift or whatever, the short scar, you're dealing with this lower part of the face here, which includes the neck. And so modern facelifting is separating out the different layers down to bone, and dealing with the gland that can sometimes poke through here, separating out all those layers and actively detaching those cutaneous ligaments and bony cutaneous, what we call osseocutaneous ligaments. And once you do that, you have to then figure out the vectors that you want to. Most surgeons now really understand that it's vertical. It's mostly vertical that you want to pull things. One of the other problems is that years ago, you lay back on the table for the surgery, everything falls back, and the doc just sort of continues and pulls it back. And that gives you, it changes your mouth in a strange way. It pulls things in a funny way. Most docs now are doing a multiplanar, deep plane facelift. They're no longer just pulling on that SMAS. And then they're detaching it, and they're understanding the vectors involved. So you're mostly going up, a little bit back, but mostly going up. And they're taking all the tissues. They're pulling the forehead up. They're sculpting the eyes a lot better. They used to skeletonize the eyes and remove the fat. We're not removing fat anymore, right, Lee? We're adding fat, if anything. So we're also acutely aware of the need to add volume and redistribute this while we're redistributing volume. A lot of people think taking fat out is going to change the lumpiness everywhere, the cheek fat. I'm very against taking cheek fat out because I know how it ages, and it really looks funny when you fall in here. You want to add volume, not take it away. So
Yeah, we don't need to look like Lurch.
yeah, exactly. That's a great point. I mean, I don't know what that guy had done, but
Yeah, I might be showing my age on that one, but
right, exactly. Yeah, hopefully everyone knows who Lurch is. But bottom line is, for a woman or a man, there's some subtle differences, but I mean, 95% of folks that having a facelift are female. But the fastest growing segment of the population for facial rejuvenation is men. And I think men are really starting to take care of themselves and look at how their face is aging and try to change it. But you can get away with a lot more in a man. There's some aging that kind of looks distinguished and it looks like you've earned your years kind of thing. You age well with it. So we don't pay as much attention to the upper eyes and the position of the brow as much. Still a little bit, but for a man, you're focusing on the jowls down here, the cheeks, the cheekbone, and the lower eyelids. The lower eyelids are the biggest sort of giveaway for a guy who's in the corporate world working real hard and suddenly has bags under their eyes. So it's in the age of people video chatting, you tend to look at yourself kind of like we're doing on this podcast. I mean, we see ourselves all the time, and we're probably, because we're facial plastic surgeons, we're probably a little critical of how we look and wishing that something could be done. But I think that it's really changed how we approach this. But for a female, as you asked, I think it's total facial rejuvenation. You wanna look at the forehead. You wanna look at how high it is. You want to look at the relative distribution of the thirds of the face, the lower face, the middle face, and the upper face. You want to tailor the forehead. Remember, there are norms to where the high part of the eyebrow is over the eye, right? And so you want to make sure that if you pull this face up, that you unburden this crow's feet area by equally raising the forehead so you don't have that bunched look. And so, and everybody recognizes this, right?
well, and that you can do that in the mirror. Anyone can do that in the mirror and see what happens.
Yeah, do it in the mirror, and you can see what happens to your lines around your eyes. But common sense wasn't part of this because we didn't have the techniques. Now that we have the techniques, there's a lot of great surgery being done out there. You don't see as many nightmares walking into the cafe when you're there, like, oh my God, what did she have done? When you look at the number of surgical procedures done, it's probably about 150,000, 170,000 a year of facelifts if you add up the general plastic surgeons and the facial plastic surgeons, which are ENTs like us, doing them. It's a large number of people, and yet you don't see a lot of nightmares walking around. So there's a lot of really good surgery being done.
Yeah, and some of it not surgery, right? So, and we'll get into that because
Yeah.
some of it are adjunctive procedures, as we call them.
Great point.
Things such as lasers, fillers, and whatnot.
Our ability to do fillers is equally improving. I mean, you saw a lot of crazy looking stuff wandering around. I think that with the sharing of social media information and how-to videos, general injectors are getting better too. That's my experience in Houston. I don't know if Florida.
Yeah, it's like anything else. You have some people that kind of don't really understand how modern injections should be done, filler injections should be done. I still have people coming in with their lips are touching me before, their hand when they're going to shake my hand. There's some craziness out there still. So the modern techniques do need to catch up. And to your point that you said before, when you're charging per vial of filler, you're going to tend to use more than is necessary sometimes.
But remember, though, there are millions of injectable sessions done, not just a couple 100,000. So there's a lot more being done, and I'm seeing a bit less of the overdone folks. So if like I think it was 1 in 5 women between the ages of 20 and 40 in Houston. I saw this stat. Someone would have to check me on it, but 1 in 5 women in that age group had injectables done, and you're not seeing that. That's a lot. That's 10 million people in the greater Houston area. So there's a lot of people having it done, and you're seeing a little bit less disasters wandering around. So I think the same thing's happening in the non-surgical rejuvenation.
Okay, let's get to the fun part. Let's look at some celebrities. And we're going to look at these celebrities.
What we've all been waiting for.
Yeah, we've all been waiting for. And we're going to talk about what we see as the difference between them. We're only going to acknowledge if someone has actually come out and said they had a specific procedure. We'll share that. Otherwise, we're really not going to speculate as to what procedure any individual had, so as not to violate any privacy, or not to make it seem like we have direct knowledge that they had something when they may not have had anything. So anything that we do say is completely speculative, and we have no direct knowledge other than what someone has said on their own as to whether or not they've received a procedure of any type. So the first one we've got is Lindsay Lohan.
First of all, she looks great.
Amazing.
These two pictures are night and day. And we see this type of thing all the time, right? What do you see when you look at that, Lee?
So, first of all, the thing that's very dramatic is her skin tone. Now, we have to understand that...
And quality. Skin quality is beautiful.
Skin tone and quality is beautiful. We also don't know under what circumstances the individual pictures were taken.
Right.
Right. So it's incredible what you can do with lighting and filters. Right.
And makeup. I mean, the makeup, these people who, when they appear at an event, have professional makeup artists work on them. And so some of these things could be makeup. And also, and she's smiling in one and not smiling in the other. So you got to take a little bit of a grain of salt with the pictures. Yeah.
So a couple of things that I see that are fairly obvious, other than the skin itself, the smoothness of her skin, the tone of her skin. Certainly, our eyebrows are thicker at a little higher level. It looks like her cheek crease is significantly diminished compared to the previous picture. Her chin contour is definitely thinner. Now, part of this could just be weight loss, right?
Sure.
But usually with that weight loss, especially as we age, we might see a little bit of sagging. So, but she's got really great facial tone.
Can you get that? You can get that with fillers, though.
Yeah.
Right. I mean, when I do fillers, that's what I look for, is trying to smooth out some of the indentations that we get with weight loss and with age.
Yeah, her nose definitely looks thinner here. Again, I don't know if that's procedural or if that has to do with just the lighting or whatnot.
Clearly, a lot of Botox here, right? Because a lot of the resting, a lot of times when you have resting wrinkles at rest, when you're not moving, you're at a sort of a later Glogau stage. And so the way that we characterize it is in something called a Glogau stage, and one of them is resting wrinkles. And you can treat that with judicious use of Botox over time. It can dramatically reduce that, and even laser.
And it used to be that when you saw someone that had forehead Botox, it was a frozen forehead. The eyebrows didn't move at all. And I think that was before people kind of understood where you should really inject the Botox and how you can do it with small amounts in certain spaces to make sure that there's still mobility of the upper eyelids. Very, very important. And the brow, I should say.
And also, eyebrows like that are getting more common. I know my wife has microblading done, and they draw in a bigger. Remember, it used to be that you'd pluck those eyebrows until they were nearly gone and then draw them back with a pencil. But now people like a full eyebrow, and the microblading that we see is really good. It looks very natural. You can place it a little bit more where you want it, so you don't have to have a forehead lift necessarily. You can actually place it slightly higher and basically sketch it in. These are like sort of semi-permanent tattoos, basically. I say semi-permanent because they need to be repeated once a year or so.
So now she's only acknowledged non-surgical treatments with fillers and neuromodulators. So just to have that as a caveat there.
And I would agree with that. And she's lost weight in this, at least from this comparison. Clearly, there's a little bit of weight loss, and some the fillers. That if she acknowledged fillers, I would completely agree with that. Her under eye area is absolutely smoothed over in a very expert way. And like to your point, she's these nasolabial folds here have been filled out a little bit. Whoever she had doing it, great job, because
I think maybe some less sun exposure too, so that where you're not seeing as much aging of the skin.
or light therapy. I don't. You can get some of that with expert light, either IPL or because she's got some variegated color going on in the first photo, and in the second, none at all. But you can get that with makeup too.
True, true. And I'm interested to hear what just as an aside, um, the thought process behind when to start having quote unquote facial plastic surgery. So is it are these are these
It's
more
decreasing. We know that.
right? So are these bigger procedures, more involved, complicated procedures at all preventable if we start doing smaller types of procedures or other types of therapies earlier on? Can we prevent requiring a facelift?
I don't know if you can prevent requiring one, but you can definitely put it off quite some time, maybe indefinitely. Again, we're exploring how these use of peptides, anti-aging lifestyles that we're talking about. We see a lot of people talking about the process of aging and what you can do just lifestyle. We've talked about fasting and how it changes the way that you age. So yeah, you can significantly put this off, which might explain to a certain extent the decrease in facelifts over the past 5 years. That people are thinking about it younger. They're starting Botox in their 20s, and some of them even in their late teens to prevent bringing on, basically all the collagen in your skin. When you move your face, you're basically like a piece of metal that you bend back and forth. It weakens it and then snaps. All those little collagen fibrils and elastin fibrils are bending and breaking, forming these static lines. If you start doing Botox fairly early, you can prevent those or put them off significantly. Plus anti-aging efforts in lifestyle and to a certain extent medications that we're coming out with. Yeah, you can put it off almost indefinitely nowadays. And we don't know yet, right? Because this is all new. So this whole generation is coming up through this, and they've put off clearly having a big facelift or by half in the past 5 years. So who knows where this could go, right?
Yeah. So like we always say, nutrition and sleep, the two biggest ones.
Yeah, we're back to our original episodes, right?
Nutrition, sleep, exercise, add some skincare in there and it could really make a difference.
And eating.
Anne Hathaway, what do you think?
One of the things that I notice about Anne, I'm a huge fan of Anne Hathaway. I love her. You only know her from the roles she plays, right? But I've always thought that she does an incredible job. I loved her in Devil Wears Prada. I loved her in Les Mis. She's incredible, and I thought I could kind of notice a little bit of aging started, and then it kind of all went away. And it's hard to tell. Again, in this photo, the after photo, obviously she's smoothed out a lot of the telltale signs of aging in her mid-face. Under the eye seems to be smoothed out, and these nasojugal, these tear trough deformities are really expertly lessened. I don't know if she got a really good night's sleep or if she had fillers or something put in there. But she also looks thinner. I mean, clearly her jawline seems much, it could be the photo though.
Yeah, that first photo there looks like when she was quite young. I mean, that looks almost like a teenage photo.
Doesn't it? Yeah, I don't know when that's from. Do we know when that's from?
Not sure.
Yeah. But yeah, she definitely, and it's also from a different angle. It's straight on, whereas the second one is kind of up from above, looking down a little bit. Her nose looks thinner, but she's smiling in the first one, and we know that can splay the ala width a little bit, so it's hard to tell there. Definitely, again, because of the smile, you're not really sure about the marionette lines, but they seem really well controlled as well. So I would probably, and her eyebrows definitely seem like they've been sculpted a little bit, either with plucking or perhaps a lift. I don't think she's had an upper bluff here, or possibly a lower bluff, but most likely filler.
Yeah, and remarkably, her lips look great, even though I don't see anything that looks like there's been any filler.
No, but she had that's one of the things I just love about her is her mouth. She has this big, luscious mouth, and I don't see that has changed at all. I don't think she needs to.
So we know whose poster is on your door. Is that what we're saying here?
No, my wife would never allow that. Probably a good thing too, but yeah, I definitely
right next to the Christie Brinkley and Farrah Fawcett.
Right, yeah. Now you're dating us.
Yeah, now I'm dating.
And I did have a Farrah Fawcett one when I was a kid.
Yeah, so did I.
And so what's the overall consensus for you anyway in terms of her skin tone? I mean, to me, it just looks like she's really taking care of herself.
Yeah, I think it's really also hard to tell with these two pictures because I'm sure the lighting is completely different.
Right.
She doesn't appear to be someone that gets a lot of sun exposure. Just even from what I've seen on screen and that type of thing, she usually always has, generally speaking, the same skin tone, and that's a huge deal. Such a huge deal. That lack of sun exposure really prevents aging over time, and I think that it's likely that she's benefited from not abusing her skin.
So we have ratings for how your skin behaves in the sun called the Fitzpatrick, right, Lee?
Correct.
And so she's a low on that scale. She's a little bit more pale, and paler folks have a very rough time with sun in terms of aging, color, and the effects that it has on the subcutaneous tissue. It tends to thin it out quite a bit. What they call solar elastosis. Those changes are rough on folks that are pale. So if you're paler, staying out of the sun is super important for aging. A little bit less so, but still important for folks that have a higher Fitzpatrick rating, getting darker and darker. But I'm a big fan of sun exposure for health and light exposure for health. But you do have to balance it with the effects that it can have on the color of the skin and the aging.
Yeah, your and my wives are lucky. They both have darker skin.
I'm swarthy. Yeah, I have some Italian in me. I do have some Scottish, and that's why I can get burned, but very rarely. So.
Yeah, no, I'm purely Eastern European, so white, pale skin, and I've got all these solar lentigines and everything all over from that.
So the big one is Kris Jenner, right? I mean, this is the talk of the town, right? She's was she 70 now?
Not sure exactly.
Yeah, she's about 70, I believe. And she had a facelift before that she admitted to, and she also admitted to, and as a matter of fact, she went as far as to disclose the surgeon, Dr. Levine, in mid to upper town Manhattan. I think he's in the 50s in Manhattan. He's sort of a contemporary and rival of Dr. Giacono that I mentioned before, Andrew Giacono, and she talked about it openly and freely. I mean, when you look at, she has a little bit of fullness in her cheeks here that she's always had.
Do you think that's from her previous Magar implants?
I think it is, but still,
we have no idea whether or not she had Magar implants or not. It's just that cheek fullness could potentially be represented by something like that. Or it could just be her
It could also
genetics.
be that she had fat removed from her cheek, and so it's caused a little bit of disparity where you can see a line here. So you're right. Yeah, there's a possibility that there were cheek implants or filler or something, possibly even fat, something that's making the cheeks a little bit bigger. But Dr. Levine did an expert job of sculpting her lower face, her eyes, her forehead, and working with what he had to really fill it out. I mean, nobody can look at Kris Jenner right now and say, "Oh yeah, that's a 70-year-old." That's amazing. The results, and some of it's skin quality too, right?
Yeah, but I would say that their skin quality from before to after has changed as well.
That's what I mean. So there's some of it is not just the facelifting that he did, but he probably was that maybe lasers that he did.
And it could be laser, as really some of the skin treatments that that the dermatologists especially have at their disposal now really can change the skin dramatically as well if used appropriately over time.
Absolutely. The dermatologists are doing they're undergoing a renaissance as well. And I can tell you that my wife has really discovered Korean skincare. The Koreans are so far. We went to Korea last summer, and I went down to a lot of the cosmetic areas, the dermatologic areas, and went into their factories. They were really kind to show me around. Absolutely stunning stuff that they're doing with simple daily skincare to prolong good quality skin. And I think that they're undergoing a renaissance like the surgeons are as well.
So let's move on to the boys. Okay,
Yeah.
Bradley Cooper
The dudes.
and the dudes.
Well, these pictures to me highlight exactly what I was saying before. I mean, for men, the goal is very different. Bradley Cooper just looks great. He's a phenomenal actor, and I've always liked his look. He has these piercing blue eyes and everything. In the first photo, I kind of see a very large forehead when you compare it to the middle and lower third of his face, and that is not apparent now. There are ways to lower the hairline that I do. The trichophytic forehead lift, for one. He has not admitted to having anything at all, and in fact, friends who are close to him have publicly said that he's had nothing done. But you look, you can see fine lines and wrinkles on his face, and it's okay in men. He has sort of a flat eyebrow, and that's okay in men.
Well, this could just be awesome aging, pure genetics.
100%, 100%. His chin in the first picture looks thinner, and so it's tempting to say that maybe he's had some implants along his jaw. But that happens with age. This tends to flatten out, and this tends to sort of resorb a little bit, and so you get a smoother appearance. Could also be the photo.
Yeah, and interestingly enough, his melolabial angle is almost the same as it used to be.
Almost identical, right?
Maybe just a little bit deeper, and we're talking about these folds here. A little bit deeper. So again, you look at this and you say, if he was going to go to someone and say, hey, I want to look better, what would they do? That's probably an area that they would have addressed. The fact that area is not addressed, again, lends more of an argument to the fact that maybe he had nothing done at all.
Yeah, I mean, he also strikes me as some kind of as a guy that takes care of himself, works out a little bit. I could be wrong, but he doesn't, he's not one of those people who his lifestyle is going to knock him over. I think he's actually probably just aging well.
What a great career, though.
Right?
Oh, my goodness.
It keeps getting better and better. Speaking of which, Brad Pitt, great career. I mean, the guy has done more different types of roles, from Seven to Ocean's 11, and what was the one where he aged backwards?
Benjamin Button.
Benjamin Button.
Yeah.
Benjamin Button. I mean, pretty versatile actor. I actually just watched River Runs Through It a little while ago, and again, totally different type of character.
Very underrated as an actor, I believe.
Yeah, 100%.
I forgot the name of the movie, but there was a movie where he played I'm not sure if it was the devil or he was just the one that came when you died, and he
Right. That was a remake of it of a something Joe Takes a Holiday or something like. What was that?
yeah, something like that, and he spoke in a Haitian accent that everyone that I speak to that's Haitian said it was spot on perfect. I mean, absolutely perfect. And supposedly, from what I read, is that he really spends a lot of time on his accents. He will spend an inordinate amount of time absolutely perfecting his accents. But if anyone watches that clip, it's really quite excellent.
He was kind of ragged on for how he did in Troy, but I think it was just how they wrote it. I don't think that they used him to his fullest because they would just wanted his body to be honed, which it was. He looked like a beast there when he was Achilles. But you look at all the other roles that he's done, absolutely remarkable, and he's never really been lauded by the Academy for it, which I find it's like kind of like Tom Cruise. Tom Cruise has had an incredible career, never really been recognized for any of the things that he's done.
Oh yeah, especially in Tropic Thunder was that?
Everybody knows he's never go full retard.
No, but he played the was it Les Grossman?
Right, right. Oh, it was fantastic. I mean, and he apparently the story is right that he created that role. He was like, dude, I want to be in there, but only if I can be a guy who's going bald and he's got big hands.
Exactly. That was great.
So Brad is these two pictures I think are really deceiving a little bit. I think Brad is just aging really well too. I don't see an upper bleph or a forehead done. I don't really see a lower bleph here at all. I see maybe some fillers to smooth out some of the undulation. He's got accessory smile lines, and he's got sort of real prominent jawline, and I think they've just sort of smoothed it out.
Which I think of natural aging, he's lost some of that bone, and that's why he's not quite as wide anymore.
Yeah, that could totally explain it. I don't think he's admitted to anything except good genes, but you could explain some of the under eye smoothness from fillers, but it's also the fact that he's smiling and lifting up his cheek fat.
Perfect. So let's go through some different types of procedures and kind of where you use them, what they are, letting people know a little bit about maybe how long does it take to do some of these procedures, or how long is the recovery for some of these procedures, whether or not procedures need to be redone, what is the rate at which they require revision. What do you tell patients? Let's start with just a standard facelift. What do you tell a patient in terms of the potential for requiring a revision?
So this is for me. This is a personal statement here. I've gone away from offering anybody mini anything. I get such great results doing the modern multiplanar deep plane facelift, repositioning with volume, and addressing everything that needs to be addressed, that I don't really offer a mini facelift anymore, or just a SMAS lift, just because I know that my results are much better if I do the whole thing, and I know that that person's going to need it. So I'll refer them to somebody else if they want a tiny little thing done especially if it's due to cost only. So I go away from that. Do you still do mini facelifts and different types of facelifts, Lee?
I really don't do a lot of facelifting anymore. I'm mostly doing rhinoplasty. That's kind of my because I'm so focused on rhinology. The rhinoplasty has just kind of been a natural progression for me. So that's where I focus most of my efforts. But I did tons and tons of facelifts and blephs and all of that stuff in my previous life, and have certainly kept up with all the modern techniques. How long do you tell a patient they may expect the results that you've given them with your facelift?
So they're permanent, but we continue to age. That's the reality, right? We continue to that process of cells after 60 to 80 divisions undergoing apoptosis and leaving us. And so you continue to have volume loss, but with modern techniques of filling volume, the repositioning lasts forever, and you can really make it, 10, 15 years before you start thinking that, maybe you can see aging taking over again. So I usually tell them about a decade.
And so at that point, would they require a full revision of the facelift, or?
No, not a full revision. Just if I've done the deep plane facelift with detachment of all the osseocutaneous ligaments, they usually just need a little tuck up,
Complications?
Yeah, so I mean, you can get some numbness. You can hurt. There are nerves when you do deep plane facelifts. You expose all the nerves laying on. You expose the spit glands. You expose the muscles below, the bone below. You expose the glands, the spit glands under here and here, the parotid and the submax or submandibular gland, and so you can injure those. You can get. I mean, obviously, the most common is a hematoma and an infection. But in general, you really need to discuss this with people. Sometimes, if people have lifestyle things that they're doing that can cause problems, like smoking, you can have skin dying, because remember you're raising up flaps through incisions along the hairline in the ear and behind the ear. And so you're asking that the blood to filter across that thinner and thinner skin for a long way. So I have everybody undergo hyperbaric oxygen treatments afterwards to minimize that. I also use some creams, that nitro paste that draws blood into that area to try to stop that sort of thing. So loss of the skin, loss of a little bit of sensation, sometimes more than others if a nerve is damaged. And also you can have movement disorders if some of the facial nerve, the motor nerves get injured. You can have movement abnormalities in the forehead, in the lip, in the nose, and so fortunately not very common, but they do happen, and so it's something that the patient needs to know about. But you can really, by technique and by a careful monitoring of your patients, you can minimize most of the common ones, like blood collections, hematomas under the skin. I see my patients, they stay overnight at my place, and then I see them the next morning before I send them off, because most of those hematomas occur in the first 24 hours. So, and then just not getting the lift that you want, visible scars, I guess you can call it a complication, I guess. You can get hardened larger scars, but like keloids, but those are fairly rare. They're common behind the ear where a lot of the pull is held. And also because a lot of surgeons don't pay as much attention to closing that, so you get some hypertrophic scars back there. But in general, that's basically what you see.
What do you tell patients in terms of how long before they can expect their quote-unquote final result?
Oh, final results, I always say 18 months for any kind of surgery, rhinoplasties or anything, because, you still go through the remodeling phase. There's phases of healing. You have your acute phase, your inflammatory phase that lasts 4 to 6 weeks, and then you continually remodel those scars over time, and they soften and fade. And so I tell them about 18 months. But I also tell them, look, you're going to be wearing some type of a garment, although there's a new quilting stitch that people are putting in to replace the garment. But you can wear this garment, the suspension garment that kind of hugs the face for about 2 weeks. And then you wear it only at night for an additional 2 weeks. So you're kind of out of it for close to a month, but you can sit in a cafe at 2 weeks and not scare children. I mean, you can, with maybe a little bit of bruising, you'll put some makeup over, but 2 weeks, you can kind of come out into the world and see folks. You'll be a little bit too good, a little bit pressed out and swollen, but you can look pretty reasonable at 2 weeks. But 18 months for the full healing process to take place. Now,
what if I scared children before the procedure?
yeah, then you may have a problem. But that's a good point. No, but really, if you're going to do it for something, I'm going to my high school reunion, I'm going to a wedding, you really want to allow about 3 to 4 months before you don't want to come in. I've patients sometimes come in, hey, next month I'm going to my son's wedding, and you're like, don't do anything right now, because you just never know. Everybody heals differently. You could have some bruising still there. You might not quite look right to family members because they know you very well and you're still swollen. So I always tell them, give it a little bit of time.
Talk about threading.
Yeah, I'm seeing some actual really good results with it for subtle things. But so the original threads were non-absorbable, barbed threads, and they stayed there forever. They had some real bad complications. I'm not a fan. But these new absorbable threads, I've seen people actually look great with it short term. It's the bane for us because you're putting it in the plane that I raise my flap in, causes a lot of inflammation. A lot of these things that people are doing that are non-invasive or minimally invasive cause problems with like deoxycholic acid that people inject into the fat under the chin to blow it apart. Well, yeah, it can reduce that a little bit, but it makes what I would do for a facelift a little bit harder and a little bit more dangerous. So it's at odds a little bit with facelifters, right? With surgeons. But I've seen some startlingly good results with subtle abnormalities in the jowls and under the chin. People are getting a little crazy with it and putting it all over the place. And I've also seen some terrible complications and really bad looks from it. But there are some folks in the Houston area that do a great job of it.
I'm a male. I come in. My only issue is I've got a turkey neck.
So, for me, I'm going to offer them a facelift. Okay, period. Because I think I can do a phenomenal facelift, and I can completely take that away and make it look natural.
Any role for a submentoplasty?
Yes, yes. They can look great. They can look disastrous, and I mean disastrous. And I've seen those. But yeah, you can actually just sort of grab this wattle and then and cut it out. If everything goes great, if they heal well and you do a really good job and at the appropriate number of Z-plasties. Remember, this type of structure here in the body, anywhere where there's an arc, is going to want to shrink up and form a web and pull down. So there have to be ways that you as a surgeon counter that and minimize that, right? And you also have to decide, is this person going to want a facelift down the road ever? And you just have to talk to your patient about that, because what you do initially just to sort of get around doing a facelift may have really tough consequences if and when you do in fact decide to get a facelift down the road. So I tend to want to make a small incision here, do a platysmoplasty, a small trim of the muscle, and then sew it together to form a sling, and then detach the cutaneous ligaments, and then do a deep plane and pull everything back up and smooth this out like a nice harness. And I just know it looks fantastic. I have a lot of male facelifts that I've done even recently. We just did one, and it looks phenomenal when you do it. And the recovery is not bad. So I tend to, if they just want that little wattle removed through a direct incision, I send them to someone else. I could do it. I just don't want the risk of what could happen and how it can look, this big Z-shaped scar under the chin. I'm not a big fan of it. But yeah, I've seen them look fantastic when done well, and the person heals well and takes care of it.
So that definitely good advice to give people in terms of when they're going and seeking out someone to take care of that area, to know that, yes, while it might be able to be done, it can decrease the chance that you're going to be able to have a really good quality facelift in the future, just because of the scarring. So that's the technical picture. Modern facelifts aren't the facelifts that people remember. The work has moved from pulling skin tight to repositioning the architecture underneath and letting the skin redrape over a structure that's been put back where it used to be. Done well, the goal is to look fixed. It's to look like you with the support your face had 15 years ago. That's the half that explains why celebrity faces have gotten so confusing. The work that used to announce itself doesn't announce itself anymore. But it's only half.
Well, it announces it on the red carpet by somebody just dropping everyone's jaw. Like, what is going on? Why do they look so fantastic? Holy cow! Rather than, oh dear, they've clearly had something done. Maybe
or hey, look, they had a bad facelift. Now it's like, well, I'm not sure what they had, right?
Now the standard is, this person steps out onto the carpet and there's kind of stunned silence, like, holy cow, they look incredible.
But now the issue is what happens to the rest of us, okay? When a generation of celebrities stops looking like they are aging at all, and the standard everyone is quality standard everyone is measuring themselves against, it stops being human, right? That's part two. The psychology, the data on body dysmorphia, Instagram and TikTok dysmorphia, the myths that refuse to die, and how a normal person should actually think about facial aging. If you've ever caught yourself scrolling and wondering why everyone seems to be aging in reverse, that's where we'll be on our next episode when we talk about the other half of celebrity facelifts. Thanks for joining us.
If you want to hear more straight talk about wellness, like this episode and subscribe wherever you listen to podcasts. That really helps us find the people who care about and want to make sense of their health.